When you're keeping a large group of animals in a collection, I don't care who you are, a zoo, a veterinarian, or a private keeper, you're going to get sick animals. And it's important to know the animal's behavior so you can get ahead of any potential problems. Take this little gal, for example. She looks fantastic, doesn't she? Awesome animal. But upon further inspection, we've got a problem.
As a pro bike rider, action sports announcer, and off-road adventurer, I'm always on the go. But for my true passion as a reptile breeder, I created my own sanctuary in South Florida. This is Kamp Kenan.
So this is Shelly. Now Shelly is a young sulcata tortoise and she's doing what they do, they graze. And she was doing the exact same thing when I noticed she had that horrendous trauma to her shell. I went into the enclosure, looked around, was just investigating everyone like I always do, but then I went to the other side of her and I saw this crazy gash in her shell and my heart sank. It's just incredible the level that tortoises can handle some trauma. You can see an animal with a horrendous shell problem like this and they'll still be eating. In fact, that's what she was doing. However, this is now months old. I could actually look into her body cavity, so my heart just sank. Now, with trauma, it's gonna be your basic first aid to get the animal stable so you can get it to a vet. So what I did was I gently irrigated the wound with a hose just to clean out any detritus or debris that might be in there. Then I took a saline solution and irrigated it, and then I put something called silvasulfidine cream, which is a white cream. It's an antifungal and an antimicrobial cream that you can get from a vet. It is wonderful. It just does, you've got to have it if you're a tortoise or turtle keeper. It's so important. So I kept the animal clean, got it to the vet, and basically what we decided to do was just let nature take its course. Keep the wound clean, which was pretty challenging every single day. I had to make sure I would just gently debride it or get away some of the gack that the cream would make, re-clean it every single day, and then I would apply fresh cream and put something called Tegaderm. It's a protective, almost like a second skin Band-Aid. It's clear so you can keep an eye on the wound on the inside. So I keep that on for a few days after we got to a certain point of healing. And now this animal is gonna do just marvelously. Like I said, they are tough animals. And when it comes to trauma like this, they can bounce back as long as you've done the proper first aid. So don't freak out. I personally don't care that she's gonna have a little scar on her shell. I think that builds character. She's gonna have a wonderful long life. So what'll eventually happen with this is you can kind of zoom in, look at this. You can see that, you know, it is still a little bit pliable, but this scar tissue is definitely growing back. Turtles heal from the inside out. She's gonna heal her shell starting from the inside of her body, where she's gonna form new bone. That bone is then going to push through and pop off eventually. It's going to take years for this animal to fully recover, but she will make that recovery. And when we're talking about tortoises, we know they can live easily 80 to over 100 years old for this particular species, the sulcata. So I'm not too worried about her, because as soon as I put her down, she's going to be eating grass again. But there are some infections and some traumas that actually are caused by microbes that we're really going to need to talk about, because those are almost always lethal if unchecked. Let's go find out about it. So we're actually inside what's supposed to be my dining room, but it is somewhat of an infirmary right now. Now, we saw trauma to the shell or injuries like that. Now, that's one thing, but what's really dangerous for turtles and tortoises are upper respiratory infections, and I'll show you why. And first off, I want to show you just how a sick tortoise behaves. Look down in here. You can see these leopard tortoises are the patients that are going to require the most care. I have some animals that are on the mend, but these guys are really sick, and you notice they're very lethargic, they're not moving around a lot, their eyes are closed, and you know, overall they just spend most of their time basking. And that's what you'll see with sick tortoises. They're trying to raise their body temperature. If they're not moving in and out of their thermal gradients, out of their basking spots, that's usually an indication that something's wrong with the animal. Another indication, I'm going to reach down here and grab this male leopard tortoise here. Another indication is the nares, the nostrils. You know, if you're seeing a discharge from there and those sunken eyes, and look, you can just see he's kind of got a sleepy look to him. definitely an animal that is not feeling well. A suppressed appetite, not as robust an appetite, not moving around a lot. That's how you're going to notice your animal's sick. If you pick it up and it feels a little bit lighter than normal, it could mean the animal's dehydrated, so that's another indication. So right now I noticed this, we got it early, but as I said, these guys are kind of the patients that I'm really focusing a great deal on right now. So what I had to do, and what I want to show you, is I'm going to tilt the animal upside down. And this is important because you can actually help drain some of the mucus. You can see it's coming out right now. It's very important to try and help clear those lungs because turtles and tortoises can't sneeze or cough. So what happens is all that mucus builds up inside their respiratory system and it can turn to pneumonia, and that is extremely dangerous to have happen for a turtle and tortoise. I've seen them die within hours. So without getting them to a vet and getting the proper medication, it can be extremely disastrous. And these respiratory problems can run through an entire colony. So you've got to separate the animals quick. You got to ID them fast, and I hope I've given you enough information how to really recognize when your tortoise is sick. Now I'm going to do what my vet said. We've got the drug. We're going to step right on over here. I've got the syringes ready. Okay, so basically what I have to do now is administer these 2 shots. This is a drug called ceftazidime that was prescribed by my veterinarian, which is good at combating this particular type of respiratory illness. So what you do, I've had these syringes all set up. You're going to grab the tortoise by the front leg, right here. You hold the leg down, and you want to take the needle, and believe me, this isn't fun, but it's necessary in order to keep the animal going. But what you want to do, gently push out any air in this needle, very gently. There we go. And then I go in what you would consider the triceps, or right here. You might want to get a little bit closer so you can see this. It hurts them a little bit. I know, buddy. You got to get in there, and then I give them 1 injection, pull it out, and then I ready the 2nd injection. And I try to be as quick as possible to keep the animal from getting too stressed. This is my least favorite thing to do because it hurts them so much. All right, so that's it. So now I have, this animal has been treated, and we're gonna put it back in its little tub. We're gonna go ahead and keep the temperatures elevated, because if the temperatures aren't high enough, them being cold-blooded animals, they won't be able to metabolize the medication. So the medication could be totally ineffective if the animal isn't kept in the high 80s, low 90s. So as you can see, there's a little pep in his step right now. Does not like getting stuck. But that's how you would identify a sick tortoise. Some tips to get them better. I have to stress, I'm not a vet. I just do what the vets tell me. I always bring my sick animals to a vet, and this way we know exactly what course of action to take. And before I go, I just want to give a shout out to my friends and mentors, Sam Pascucci from Florida Turtle and Iguana Farm. He's been instrumental in helping me with this type of knowledge. And a good friend of mine, Amanda Ebenhack, who is a wildlife rehabber, and she definitely knows her stuff as well with turtles and tortoises. So thanks to you both. Hopefully we'll get these guys on the mend. And now you have a little bit of an idea of how to figure out if your turtle or tortoise is sick. All right, buddy? Well, let's put him back and let him rest. See you next time.
Thanks so much for watching. And as always, be sure to check out the Kamp Kenan channel on YouTube and become a subscriber today.